Deputy Roisin Shortall.
Thank you, Ken Corley. I'm glad to have the opportunity to speak in this debate. I think it's an important one, and I commend Sinn Fein for the detailed motion that they have tabled. This is an issue that a lot of concern has been expressed about over many years, and clearly in the past 15 to 18 months, a lot of the shortcomings in the care service in elder care were brought into tragic and stark relief due to the very high number of deaths that took place in our nursing homes. And some of those situations were highlighted in great detail in the recent RT Investigates programme. And I want to commend Barry O'Kelly for the work that he did in that programme. And there is no question but that the homes covered in that programme, the whistleblowers that came forward and disclosed some of the awful practices that were going on in these nursing homes, they require further investigation, and I believe that there is a need for a public investigation into those particular nursing homes, into the allegations made by those whistleblowers, and indeed I have no doubt that there are other nursing homes where similar bad practices existed, and bad practices which resulted in tragedies for a number of the residents concerned. But of course, this is an issue that we knew about. It was a scandal waiting to happen in many ways. And was it really any huge surprise that there was such a high death level throughout the COVID, throughout the period when COVID was raging? And it's not really, when you consider how there was such light touch regulation in this important care sector. And that's something that responsibility has to be taken for. People have spoken about lessons that were learned and that need to be learned from the experience of the past 15 months or so with COVID. And, it's been said on umpteen occasions that there can be no going back to the old way of doing things. But there is no doubt that COVID exposed huge weaknesses in how we provide public services. And that's right across the board, most particularly in relation to our health service generally, but also then in relation to childcare, in relation to how we, the funding model for our education system, for example, but specifically in relation to social care. Whether that's in relation to people with special needs in the whole disability area or in relation to elder care. It has exposed huge weaknesses in how those services are provided, and the overdependence on the private sector, the farming out of responsibility for what should be core social care services. And we have to stop that, and we have to go back to doing things in a different way. The state has to take responsibility for the provision of those services, and where they're not being provided directly, where there's private involvement, there must be strong regulation. I was struck at the time, I remember before the summer last year, after the first wave of COVID, and people talking about lessons that had been learnt. And I remember very clearly the Taoiseach of the day, Taoiseach Varadkar, saying that we must find a new model of care for elder care. And he was very specific about that. He said we cannot continue to provide older people services in the way we're doing that. We must be much more creative, we must be much more caring, and we must listen to what older people themselves want and what their families want. And yet, here we are, 12 months down the road, with the third tragic wave, with the massive impact that had on older people, that it took the lives of so many additional older people, caused so many tragedies within families, and still there's nothing specific coming from government about how we ensure that we don't have a repeat of this and that we provide services in a more person-centred, responsible manner. I would say that, there is no excuse for not learning lessons. This time last year, the whole issue of older people's care and nursing homes in particular was examined in great detail. First of all, by the COVID committee, the special committee on COVID, and secondly, in relation to the expert group on nursing home care that was established by government. And their recommendations could not have been clearer. I would also say that last year a very worthwhile submission was made by Sage Advocacy, and there was attendance, a written and oral submission by that organisation to the Special COVID Committee. And indeed then and since then there have been very strong cases made by care champions. And yet we don't have that new model of care. And there are three areas in particular that need urgent attention in my view. The first is in relation to that light touch regulation, a feature of so many aspects of how we provide things in this country. But light touch regulation in the nursing home care has resulted in large numbers of tragedies and deaths. And, there is no denying that fact. HIQA, which is, supposed to be the regulatory authority in charge of nursing homes, simply does not have the powers that it needs to have in order to provide effective regulation. Last year, we know that HIQA said that the current regulations need to be modernised and enhanced with additional powers and requirements. I mean, when you actually look at some of the detail of HIQA's powers, where they have to give notice of visitations and inspections, they have to, provide 4 weeks for response from the nursing home. A whole lot of things like that are just far too weak. They don't have the power to enforce staffing guidelines, staffing ratios, for example. I mean, that is just unbelievable, that there are no staff to resident ratios in our nursing homes. Why is that the case? And as a result of that, in many cases, there's no nurse on duty. In many cases, there are large numbers of untrained and unqualified staff providing care and attention to our most vulnerable citizens. Why is that allowed to happen? I mean, that is a complete abdication of responsibility in relation to our most vulnerable people. We also know that HIQA has called for safeguarding legislation. It said that we need to explore suitable structures and processes for external oversight of individual care concerns. And again, how long is this going on? How long has it been with the Law Reform Commission? And certainly they were in before the Health Committee there during the year, and it doesn't look like there's going to be recommendations coming anytime soon. So again, another long-fingered exercise. We know also in relation to the Special Committee made very clear recommendations in relation to increased powers for HIQA, staffing ratios and safeguarding legislation. And those calls have been echoed and indeed have been outlined for some time by Sage Advocacy and also by care champions. Care champions, for example, said, we want HIQA to have expanded powers to intervene. We want an end to announced HIQA visits and greater accountability for the nursing home sector. We're asking for statutory staff-resident ratios in all nursing homes. We need an independent one-stop complaints mechanism for both private and public nursing homes. And of course, at the root of all of this, at the root of this lax light touch regulation, is the fact that successive governments have seen fit to privatise the elder care system. What is essential social care, which should be an essential element of our publicly provided health service, they've chosen to privatise that to the extent of 80% of nursing homes, so that nursing home care now is regarded more as a good investment opportunity rather than an essential part of our nursing home care. Equally, I would say that the Irish Association of Social Workers have been very vocal in relation to this, and it's essential that they have the right to go into all nursing homes and address concerns, address complaints that are raised and take those up. But as of now, there is a complete lack of clarity in relation to the role of social workers in relation to safeguarding. So look, there's no more excuses for this. All of the recommendations, all of the weaknesses are there in black and white from a number of sources. What we need now is action from government, and it can't come too soon.
Thank you, Deputy Shortall. Deputy Breed.